This presentation will review some key facts about ADHD, including a discussion of ADHD symptoms. What is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. ADHD is characterized by a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development. There are three core symptoms of ADHD. These are being unable to pay attention, called inattention, being highly active, called hyperactivity, and acting suddenly without control, called impulsivity. People with ADHD may be inattentive, may be hyperactive, and may act impulsively. ADHD symptoms must occur in more than one setting, such as work, school, or other activities. Remember, only a trained healthcare provider can accurately diagnose ADHD. There are many myths about ADHD. Let's take a moment to dispel some of these. Despite what some may think, ADHD is not caused by bad parenting. It is not a measure of intelligence or a lack of willpower or desire on the part of a person to achieve a certain task or goal. ADHD is often thought of as a kid's disease. In the U.S., 11% of school-age children were reported by parents to have ever been diagnosed with ADHD. According to a survey, it's estimated that 4.4% of U.S. adults ages 18 to 44 have ADHD. And research shows that up to 50% of children with ADHD may continue to meet the criteria for the disorder in adulthood. To be diagnosed with ADHD, a person must have shown all of the following: at least 6 inattentive and/or 6 hyperactive impulsive symptoms. For people ages 17 and older, only 5 of these symptoms must be present in at least one category. Some of the symptoms of inattention include making careless mistakes and paying poor attention to details, being unable to pay continuous attention and staying away from tasks that require sustained mental effort, poor listening and organizational skills, losing items needed for tasks and being forgetful in daily activities, and getting easily distracted. Some of the symptoms of hyperactivity impulsivity include often fidgeting and squirming and leaving one's seat. Individuals may feel restless and may feel always on the go. Additionally, someone exhibiting the hyperactive impulsive symptoms of ADHD may talk a lot and may blurt out answers or have trouble waiting their turn. They may also interrupt others. These are the criteria used to diagnose ADHD. It is important to note that these are not the only criteria that may be used to diagnose ADHD. Diagnosis should be based on a complete history and evaluation by a healthcare provider. Remember, only a trained healthcare provider can accurately diagnose ADHD. As shown in this chart, people of different ages can show the same symptoms in different ways. For example, symptoms of hyperactivity can remain a consistent symptom of ADHD as a patient ages. However, as an individual ages, hyperactivity can often take the form of inner feelings of restlessness. It is important to remember that having some of these symptoms does not necessarily mean an individual has ADHD. ADHD is characterized by a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development. People with ADHD may have difficulty sustaining attention, may be hyperactive or restless, and may act impulsively. These symptoms of ADHD occur in more than one setting, such as work, schoolwork, or other activities. ADHD starts in childhood but can continue through adolescence and in adulthood. ADHD symptoms present differently as a person ages. In the United States, it is estimated that 11% of school-age children and 4.4% of adults are affected by ADHD. Be sure to talk to the doctor if you have any questions about ADHD.